Welcome to the College of Licensed Practical Nurses Manitoba's 2026 Annual Professional Learning Module. The focus of this year's learning module is your professional responsibilities related to the nursing assessment, the core of the nursing process. This learning module will provide a detailed overview of the professional expectations that are related to nursing assessments in licensed practical nursing practice. Note that if for any reason you need to close the learning module before you have completed it, your progress will not be saved. Simply take note of where you are in the module before closing your browser so you can fast forward to that same spot when you have time to return to it. Once you have completed this learning module, you will need to complete a brief quiz, which has been developed to confirm your understanding of the material. The quiz will be comprised of 15 questions. At the end of this module, we will provide you with specific instructions on how to access the quiz. Why has the CLPNM prioritized the nursing assessment as the topic for this year's annual professional learning module? We understand that for many nurses, this topic may seem entry-level. However, the CLPNM has received an increase in reports, concerns, and complaints about nurses, including LPNs, failing to assess in a timely manner and to conduct a comprehensive assessment. Although performing a nursing assessment is learned in entry-level nursing education programs, this module is intended to ensure that all LPNs, particularly those new to the profession or new to Manitoba, are familiar with their responsibilities as a member of the profession in this province. This module is also intended to act as a reminder for all members of the profession. The purpose of this module is not to teach how to assess, but rather to ensure LPNs understand their professional responsibilities and accountabilities surrounding assessments. Assessment is a core part of the nursing process, and LPNs in Manitoba are responsible for the full nursing process. When the client's needs require an LPN's intervention or involvement from other healthcare providers, the LPN is still responsible for assessing and determining when to collaborate or involve other providers in the client's care. This requires LPNs to have the nursing knowledge, judgment, and skill to gather assessment data and make determinations about a client's status and about how to act on their findings. Should you feel that you could use a refresher on performing a health assessment, you may wish to consult relevant nursing textbooks or the refresher education opportunities listed further on in this module. This annual professional learning module will discuss the regulatory framework for Manitoba's LPNs, the nursing process, which includes assessment, standards related to nursing assessment, relational practice, documentation and communication, and practice scenarios. By the end of this learning module, you will understand your professional responsibilities related to assessments and how to meet those professional responsibilities within your practice. You will also leave with an understanding of why timely and comprehensive assessments are an integral part of providing safe, ethical, and competent nursing care. In Manitoba, entry-level licensed practical nurses at the beginning of their careers are able to provide nursing care in a variety of settings to clients with a range of complex health conditions across the entire lifespan. LPNs perform holistic and comprehensive health assessments on clients using the nursing process to deliver safe, competent, and ethical nursing care. LPNs use critical thinking, critical inquiry, clinical reasoning, and clinical judgment in the application of the nursing process. They make accurate, timely, and appropriate clinical decisions to produce the best possible care outcomes for clients. An LPN's clinical decisions are informed by best practice, current evidence, and the data gathered from detailed and comprehensive health assessments. Health assessments are at the core of an LPN's practice. Up next, we will look at some of the authoritative documents that direct and guide LPN practice in Manitoba. Understanding the guidance in these documents is foundational to understanding what is expected of you as a practical nurse when you carry out health assessments. Practical nursing in Manitoba is directed and guided at all times by legislation, as well as professional standards, a code of ethics, competency documents, and practice directions and guidelines, all of which are available on the CLPNM website. Members of the public and other members of the healthcare team can have confidence in the care provided by a Manitoba licensed practical nurse, knowing that LPN practice is subject to these authoritative documents. The CLPNM Standards of Practice and Conduct are authoritative statements that define professional expectations for practical nurses in Manitoba. The standards are applicable to all practical nurses in all settings, roles, and practice areas. The standards provide the benchmark against which practical nurses are measured and describe what members of the public can expect from practical nurses. The primary purpose of the standards is to direct safe, ethical, and clinically competent practice and professional conduct. Many of the professional responsibilities related to the nursing assessment can be found in the standards, so we will touch on several specific standards in more detail later on in this module. The Standards of Practice and Conduct is complemented by the Code of Ethics, which articulates specific ethical expectations. The Code of Ethics describes the ethical responsibilities of the profession, rooted in professional values which serve as the foundation for the nurse's professional nursing practice. The Code of Ethics states that LPNs will practice with a people-centered approach, providing compassionate, safe, ethical, and competent care while ensuring professionalism, integrity, and accountability. The Code of Ethics also reinforces the nurse's duty to provide care, which refers to a nurse's professional and ethical responsibility to provide safe and competent nursing care to a client for the time period that the nurse is assigned to provide service. Meeting the duty to provide care includes conducting timely and comprehensive assessments. The ethical responsibilities outlined in the Code of Ethics also include taking all reasonable steps to avoid doing harm, notifying the client if harm should occur, taking appropriate action to prevent further harm and complying with related employer policies, taking professional action to meet the needs of the clients, placing the interests of the client above the nurse's own interests, acting as a role model, resource, and mentor, exercising judgment in directing and delegating client care to other healthcare providers, and practicing nursing reflectively and ethically. Each of these ethical responsibilities has a bearing on your nursing assessments and on your prioritization of those assessments. Nurses, as members of a self-regulating profession, are responsible for knowing the Code of Ethics and are accountable for their actions and decisions. All CLPNM registrants in all roles and settings are held accountable for understanding, upholding, and promoting the ethical standards in the Code of Ethics. The CLPNM's competency documents also form part of the regulatory framework that guides and directs LPN practice in Manitoba. Entry-level competencies describe the minimum knowledge, skill, and judgment required of a member of the profession for safe, competent, and ethical practice in Manitoba. These competencies are set out in the CLPNM Entry-Level Competencies for Licensed Practical Nurses in Manitoba document. The range of competencies that fall within the full scope of the practical nursing profession in Manitoba are set out in the Nursing Competencies for Licensed Practical Nurses in Manitoba document. These competencies are specific to the nurse, reflecting their experience and additional education. These competencies are developed throughout the nurse's career. While the competencies that fall within the profession are broad, an LPN's unique set of competencies should match those needed to meet their client's needs. When this expectation is applied to assessments, it means that LPNs must ensure that they have the competence needed to carry out the assessments that are expected and required of them in their specific nursing role. LPNs must also possess the competence and clinical judgment necessary to recognize when an assessment or reassessment is required. LPNs must self-assess and accept responsibility for ensuring they have acquired the comprehensive knowledge, skill, and judgment to perform a nursing activity safely and in the client's best interest before they carry out the activity within their practice. This means that an LPN who is not competent to perform an assessment or to recognize the need for an assessment that is expected of them in their practice environment must seek out additional education to build their competence and to safely care for their clients. Nursing assessments are at the core of the nursing process, which is the systematic approach to practice that encompasses all steps taken by nurses to meet the needs of the client. We will discuss the nursing process and how it revolves around the nursing assessment in the next section of this module. The nursing process framework consists of assessment, nursing diagnosis, planning, implementation, and evaluation. The nursing assessment is the core of the process. All later steps are informed by the initial assessment. The nursing process is a cyclical, dynamic, interactive process requiring you to move back and forth within the phases of assessment, nursing diagnosis, planning, implementation, and evaluation. The nursing process integrates analysis, evidence-informed practice, and critical thinking. Understanding how to use the nursing process is an entry-level competency for LPNs in Manitoba. This means that all LPNs are expected to know how to use the nursing process to deliver safe, competent, and ethical nursing care to clients across the lifespan. The nursing process shows up in the professional standards of the profession, which we will discuss in the next few slides. In Meeting Standard 14, you must consistently and competently apply as a framework the nursing process, which is the systematic approach to practice that encompasses all steps taken by nurses to meet the needs of the client, including assessment, diagnosis or determination, planning, implementation, and evaluation. For example, your client complains of chest pain. As a nurse, in keeping with Standard 14, you know to apply the nursing process. You assess your client's vital signs, you inspect their general demeanor and appearance, you listen to their chest sounds, you ask your client more probing questions about their recent activities, and you review their chart and medications. And you find the client has a history of angina and has nitroglycerin spray ordered for use as needed for chest pain. You determine that the client is experiencing chest pain, possibly related to exertion they experienced from walking the length of the hallway. You make a plan with your client that involves them sitting comfortably in their room while you retrieve the nitro spray. You implement your plan by administering the nitro spray to your client as ordered. You evaluate the effectiveness of the medication by obtaining another set of vital signs and asking your client if their chest pain has improved. Your client is now comfortable and does not require further interventions. You then document every step of the nursing process in the client's chart. You would also continue to monitor and reassess the client. In Meeting Standard 17, you must apply knowledge and critical inquiry in the problem-solving and decision-making processes. For example, your client is suddenly very confused and is unable to get dressed on their own. The client's family question if the client has dementia. As the nurse, you understand your professional responsibility related to Standard 17, so you question the family member's assumption and gather evidence by conducting an assessment that you can analyze with a critical lens. You have knowledge that dementia typically begins slowly and is gradually noticed over time, but delirium is usually a sudden change in a person's condition that can be classified as an acute confusional state. Your critical inquiry leads you to ask the physician to order tests to rule out a specific illness, like a urinary tract infection or pneumonia, that could be triggering delirium in your client. The tests show a UTI. The client is started on antibiotics, and the acute confusion clears up. Your nursing knowledge and critical inquiry led to problem-solving and decision-making processes that helped your client feel like themselves again. In Meeting Standard 16, you must use critical thinking when collecting and interpreting data and when planning, implementing, and evaluating nursing care. For example, as part of your assessment, you obtained vital signs on your client. The readings are not within normal range, and your client is showing other abnormal signs and symptoms. As the nurse, you interpret the assessment data and follow through with the nursing process. Next, we will look more closely at the core of the nursing process, the nursing assessment. All entry-level LPNs are expected to have the competence necessary to perform holistic and comprehensive health assessments on clients across the lifespan. The purpose of the nursing assessment is to make a judgment or nursing diagnosis based on the data you have collected from various sources. This means that a quality health assessment and physical examination are foundational to your nursing practice, and the assessment conducted must be factual and complete. A systematic assessment is integral to your ability to respond effectively to your client. Conducting an assessment is an ongoing process throughout caring for your client, as evaluating the care provided leads back to assessment. In Meeting Standard 38A, when engaging in practical nursing in a clinical practice setting, you provide nursing care that includes an assessment to determine the needs and circumstances of the client. For example, every shift you work, you assess each client on an individual basis because each client has unique issues that need to be addressed through your nursing care. This professional responsibility is also discussed in the entry-level competencies. All entry-level LPNs are expected to have the competence necessary to perform holistic and comprehensive health assessments on clients throughout the lifespan, to determine the most appropriate health assessment techniques for the specific context of clients and their current healthcare needs, to establish a baseline assessment to assist in recognizing normal diagnostic values of clients and preventing possible complications or deterioration of their health, to use a range of assessment techniques and tools to collect relevant and accurate data, to conduct a comprehensive and systematic health assessment using a relevant, evidence-based assessment framework to collect client data, and to use standardized assessment tools and resources to meet the individual needs of clients. The next step in the nursing process, which builds on the LPN's assessment, is the nursing diagnosis. All entry-level LPNs are expected to have the competence necessary to analyze and interpret assessment findings to formulate nursing diagnoses specific to each client's healthcare needs. A nursing judgment or diagnosis cannot be determined without an assessment. To arrive at a nursing judgment or diagnosis, the nurse must interpret the assessment data through integrating their knowledge related to disease processes, etiology, pathophysiology, clinical manifestation, and alterations in your client's health to identify pertinent assessment data and client needs. The nurse must identify patterns in the data through analyzing and interpreting the assessment findings. They must formulate the nursing diagnoses based on the assessment. The nurse must integrate their assessment findings, clinical data, and identified nursing diagnoses in the development of a comprehensive nursing care plan specific to their client's healthcare needs. And the nurse must communicate the nursing diagnoses to clients and the healthcare team. Planning of nursing care is the next step of the nursing process. All entry-level LPNs are expected to have the competence necessary to integrate assessment findings, clinical data, and identified nursing diagnoses in the development of a comprehensive nursing care plan. In the planning stage of the nursing process, you use your assessment findings to prioritize problems and nursing diagnoses, formulate goals and health outcomes, and identify nursing interventions. You plan nursing care in consultation with your client and the interprofessional team as necessary by identifying expected and agreed upon health outcomes and the time frame for achievement, incorporating assessment data from other healthcare professionals when planning care as necessary, documenting and communicating the plan of care, ensuring clear communication among healthcare providers, planning for continuity of care to achieve the expected outcomes, and incorporating conflict management strategies when required. After you have assessed, planned, prioritized, formulated goals, and identified interventions, you will implement your planned interventions. All LPNs are expected to have the competence necessary to implement the most appropriate nursing interventions according to assessment findings, client preference, the client's healthcare needs, and desired outcomes. During implementation, you continue to conduct assessments while you use your clinical judgment and critical thinking to adapt interventions as needed based on your client's response. To ensure the care is relevant and safe, before performing a nursing intervention, you reassess your client and evaluate the reassessment data, comparing it to your last assessment or the baseline assessment to ensure the intervention is still appropriate. Implementation of the nursing process means identifying priorities and prioritizing care based on your assessment and your client's needs and acuity, providing nursing care according to the documented care plan, while assessing to ensure that the intervention is still relevant and safe, responding effectively to unexpected or rapidly changing situations by conducting focused assessments, and maintaining clear, concise, accurate, and timely records of nursing interventions, including your assessment findings. Once you have implemented certain interventions, you will evaluate the effectiveness. All LPNs are expected to have the competence necessary to evaluate their client's progress towards the expected health outcomes in consultation with their client and with the interprofessional team. The evaluation involves reviewing the assessment data that helped to create the nursing care plan and determining the progress that has been made towards the planned outcomes, and revising the plan of care as required based on your reassessment and determining further outcomes in accordance with the evaluation and reassessment data. Meeting your assessment standards means more than gathering data. It also means approaching every client interaction relationally. We will discuss a relational approach to assessments in the next few slides. LPNs carry out the nursing process, including their assessments, while also meeting their broader professional standards, which include applying a relational and person-centered approach to care. A relational approach aids to make every health assessment a safe, health-promoting experience. This approach to care focuses on building a meaningful therapeutic relationship between you and your clients. It is grounded in client-centered care, recognizing the nurse-client relationship contributes to healing. A relational approach guides you to enter all nursing situations as an inquirer. In this way, you are inquiring into the experiences of your client's understanding of their health and well-being, and how your client manages their state of health. There are 3 levels of inquiry to the relational approach. The levels represent an intrapersonal, interpersonal, and contextual approach to the therapeutic relationship. In the intrapersonal level, you, as the nurse, assess your client and consider what is going on with your client, what is important to your client, and what your client might be overlooking, including what others, such as family members, might be experiencing. The interpersonal level focuses your attention on how your client is experiencing being assessed. As an example, when you are taking a blood pressure, you likely consider this to be standard practice. However, for your client who is having their blood pressure taken, this can be a much different experience. Your client may be worried their blood pressure is high, or they may wonder if you will know they are anxious about the blood pressure reading, or the client may have other concerns. The third level of inquiry is contextual. Here, your assessment would consider what is going on around your client and their circumstances. This is referring to the structures and conditions of our society that influence all people, but specifically your client's health and well-being and their intrapersonal and interpersonal responses. The experience of a physical assessment will be different for a client with a chronic illness who has experienced health assessments previously, as opposed to a client who has not. Another example is a client who has experienced a personal violent assault, who may be more fearful of being touched in the process of an assessment than someone who has not. Focusing attention on these levels simultaneously while conducting your assessment will enable you, as the nurse, to take a comprehensive approach to the health assessment that is as safe as possible and will serve as a basis for responsive and effective nursing actions. As an LPN, when you apply a relational approach to care, including when you carry out client assessments, you contribute to establishing and maintaining the therapeutic nurse-client relationship. For further information on meeting your standards related to therapeutic relationships, please read the CLPNM practice direction on therapeutic relationships and professional boundaries, and the CLPNM standards and focus articles titled Therapeutic Relationships Under Involvement in Client Care and Therapeutic Relationships Over Involvement in Client Care. All of these resources are available on the CLPNM website. While a relational approach is foundational to every assessment, equally important is what happens after you assess, documenting your findings thoroughly and communicating them clearly to the healthcare team. We will look at both of these responsibilities next. Documentation is a written account of all pertinent data, clinical decisions, interventions, and client responses in a health record. Should your client's condition become more complex, the risks to your clients are greater. This means that your assessments need to be more frequent or in-depth, and your assessments must be documented with enough information for another provider to be sufficiently informed of the care provided and of the client's response to that care. Remember, if it was not documented, it was not done. For more information on your documentation standards, please refer to the 2024 Annual Professional Learning Module on Meeting Your Professional Standards Through Documentation on the CLPNM website. Communicating your assessments through documentation is not enough. Timely reporting and sharing your recent assessment findings and relevant client care information with the client and the team is integral to safe transitions in client care. For further information on meeting your standards in reporting and transitions in care, please read the CLPNM Standards and Focus article on reporting and transitions in care, which is available on the CLPNM website. Every assessment you complete reflects your professional judgment and accountability as an LPN. The standards that follow highlight your responsibility for when and how you assess, how you prioritize client needs, and how you act on your assessment findings. In meeting Standard 1, you must accept accountability for your nursing practice, including the care you provide based on your own assessments and determinations, the care you provide that is initiated by other healthcare providers, and the care you provide that is delivered as part of a collaborative team. For example, a fellow nurse is busy and asks you to document some assessment information for them in their client's chart. You are not involved in the care of this client, and you have not assessed them or treated them yourself, so you let your coworker know that you will not be able to document any assessments you did not perform or any care you did not provide to the client. You also ask your coworker if there is something you can do for them so they may catch up on their work. In meeting Standard 4, you must accept accountability and take responsibility for your own professional conduct, decisions, practice, and errors. As an LPN, you know you are accountable and responsible for maintaining the competence needed for the assessments required in your nursing practice, your decisions about when to assess and when not to assess, your decisions about how to prioritize assessments, and the actions you take following your assessments. For example, you are new to working in a personal care home, where client falls may be a common occurrence. You realize you have not performed a post-falls assessment on a client in several years, so you look up and study how to perform this assessment. You review employer policies and procedures related to falls management and neurochecks, and you review the post-fall assessment and management algorithm and checklist so that you are competent to complete this assessment as needed with your new clients. Now that we've discussed an LPN's professional responsibilities that relate to assessment, we'll move on to discussing in more detail how the standards related to assessment apply in a nurse's professional practice, as illustrated in the following practice scenarios. Jana Sabor, LPN, works in a personal care home in Manitoba. Jana is about to go for lunch break and performs a quick check of her clients before stepping away. On her rounds, Jana finds 81-year-old Mr. Roy on the floor of his room. Jana immediately calls for help, both verbally and by pulling the call bell in the room. While waiting for help to arrive, Jana takes note of Mr. Roy's position on the floor and the surrounding environment. Without moving the client from the floor, Jana conducts an immediate nursing assessment by checking Mr. Roy's circulation, airway, breathing, and vital signs. Jana also assesses the client's level of consciousness and finds that Mr. Roy is alert, but he cannot recall how he fell. Jana then asks Mr. Roy if he hit his head and if he has a headache, but he is not sure. Jana asks if the client has any neck, back, arm, leg, or hip pain, or if he has any numbness or decreased sensation anywhere in his body. Additionally, Jana assesses Mr. Roy for any bleeding, bruising, swelling, and for any fluid loss from the nostrils or ears. She also carefully checks the client's range of motion. Jana puts her initial assessment findings together as follows. Mr. Roy's fall in his room was unwitnessed. The client is alert. He cannot recall how or why he fell. He cannot recall if he hit his head or not. His blood pressure and pulse are slightly elevated, but his other vital signs are within normal range. Upon visual inspection, Jana notices a small cut along Mr. Roy's hairline that is bleeding slightly. Mr. Roy has some pain in his right elbow, and he suffered a skin tear to this elbow. And he has no pain, numbness, or loss of sensation in his other limbs, and appears to be able to move his joints freely. When staff arrive several minutes later, Jana gives them a report of her assessment findings. The staff helps to clean up and dress Mr. Roy's small head wound and his elbow skin tear, and they determine that Mr. Roy can be moved to his bed using a mechanical lift. Once Mr. Roy is safely and comfortably in bed, Jana initiates neurochecks per facility protocol due to a suspected head injury sustained by the client during their fall. Jana contacts the client's family to let them know about Mr. Roy's fall and post-fall care plan. Jana also documents the details of Mr. Roy's fall, all of her initial assessment findings, and all subsequent assessment and neurocheck results in the client's chart. Pause the video to consider this practice scenario. When you restart the video, I will discuss if Jana met her professional standards or not. In this scenario, the LPN, Jana, met her standards of practice and conduct by appropriately assessing Mr. Roy after his fall and by following her employer's post-fall assessment and management protocol. From a regulatory perspective, Jana did what was expected of a reasonable, prudent, and competent LPN in this situation. Specifically, Jana conducted a timely and comprehensive post-fall assessment, used clinical judgment to assess risk, avoided moving the client until assessment was complete and help arrived, followed employer protocols for escalation and monitoring, communicated effectively with the staff and family, and documented assessment findings. From the CLPNM's perspective, this scenario demonstrates appropriate prioritization, accountability, and use of the nursing process. Because Jana assessed and acted appropriately, potential injuries, including head injury, were identified early, the client was kept safe, appropriate monitoring was initiated, pain and minor injuries were treated promptly, and the client's family was informed, supporting transparency and trust. Importantly, This scenario shows that good outcomes are often invisible. Harm was prevented because the LPN did not miss critical assessment steps. From a regulatory lens, prevented harm is still a positive outcome. Why does this matter from a CLPNM perspective? The CLPNM frequently receives reports and complaints related to falls that were minimized or not assessed. This scenario illustrates what the regulator expects when a fall occurs. The LPN recognizes falls are not routine events, even in clients with a history of falls. Visual inspection alone is not an assessment. Being busy or near break time does not remove accountability. An assessment must guide decisions about movement, monitoring, and escalation. JANA's practice aligns with the CLPNM's mandate to protect the public by ensuring nurses identify risk and take action to safeguard clients. Meeting standards is not just about doing the right thing. It is about preventing harm, supporting good outcomes, and protecting your professional practice. This scenario sets the benchmark for how LPNs in Manitoba are expected to respond to a fall and serves as a contrast to later scenarios where assessment is missed or delayed. Pat Goya, LPN, works at a rural hospital on a medical unit. Pat is busy with completing their tasks as they are nearing the end of their night shift on a Monday, when an emergency call bell is alarming and they hear a staff member calling for help. Pat enters the room of 76-year-old Mrs. May, who was on the floor near her bed. A healthcare aide, Todd, states that he tried to transfer the client to the bedside commode, but Mrs. May slipped from his grip and fell to the floor, so he immediately called for help. Pat quickly looks Mrs. May over and doesn't see any blood. Pat notices that the transfer belt Todd had used is sitting up around Mrs. May's armpits. Pat's only question to Mrs. May is if she thinks she broke anything. Mrs. May states she is unsure. Pat asks the healthcare aide if the client actually fell or if she slid to the floor. Pat adjusts the transfer belt to go around the client's waist, then asks the healthcare aide to help manually lift and transfer Mrs. May from the floor to her bed. When two other staff members arrive in the room, Mrs. May is already lying in bed, and Pat waves them off and says the client is fine, without mentioning the fall. Pat does not assess Mrs. May any further and tells the healthcare aide that Mrs. May is fine and it's time for them to go home because it's the end of the shift. Pat leaves the unit without informing the oncoming staff that Mrs. May had a fall, nor do they call the physician or the client's family. Pat also fails to document Mrs. May's fall in the client's chart. 2 days later, on Wednesday, Pat arrives for their next shift on the medical unit and is approached by their nurse manager, Nora. The manager informs Pat that Mrs. May was transferred off the unit on Tuesday afternoon, the day after Pat's last shift. Mrs. May apparently had suffered an ankle fracture that was discovered on Tuesday morning when the day nurse assessed Mrs. May. Nora learned of Mrs. May's fall from Todd, the healthcare aide, and the two staff who attended the emergency call bell that day. Pat admits they were the nurse who answered Todd's call for help and that they looked at Mrs. May, and the healthcare aide told them that the resident slid to the floor and didn't really fall, and that she seemed okay, so they transferred her back to bed. Nora asks if Pat completed post-fall assessments on Mrs. May and if they charted their assessments, and Pat admits they did not, since they didn't think it was really a fall anyway, and from what they could see, Mrs. May seemed fine. Pat tells the manager that they didn't see any blood, and Mrs. May did not complain of any pain. And it was the end of the shift, so they did not assess the client any further and did not have anything to document or report related to the situation. And since it was the end of shift, Pat figured the oncoming staff would take care of Mrs. May anyway. Please pause the video to consider this practice scenario. When you restart the video, I will discuss if Pat met their professional standards or not. In this scenario, the LPN, Pat, did not meet their standards of practice and conduct when they failed to appropriately assess Mrs. May after her fall. Pat also failed to follow their employer's post-fall assessment and management protocol. From a regulatory perspective, every fall requires a timely nursing assessment. Even if it is reported as a guided fall or slide to the floor, it is the LPN's responsibility to assess the individual. When LPNs are busy or their shift is ending, their professional obligations and their duty to provide care means that an assessment must occur. The LPN should have completed an immediate post-fall assessment before moving the client, followed employer post-fall protocols, used appropriate equipment to transfer the client, initiated monitoring and escalation as required, and documented and communicated the event. If the LPN in the situation required assistance due to conflicting duties or time constraints, it is the LPN's professional responsibility to seek out assistance to ensure all clients receive the care required. Failure to assess the client after a fall increases the risk of undetected injury, delayed treatment, and pain. In this scenario, Pat's manager Nora might have informed Pat that this incident would be reported to the Protection for Persons in Care Office, or PPCO, as well as the CLPNM, as they neglected to assess and care for their client post-fall. Falls-related complaints frequently lead to regulatory review. Where assessment is missed or delayed, the CLPNM may identify unsafe practice, failure to identify risk, and/or failure to follow standards and employer protocols. This may result in remediation, conditions on registration and practice, or discipline. Manny Wose, LPN, works as a home care nurse. One of his clients today is 72-year-old Miss Parr, who has difficulty ambulating, is mostly bed and/or chair-bound, and has developed a coccyx pressure ulcer as a result of immobility. Miss Parr's coccyx wound dressing is due to be changed today. Manny reads the client's orders and chart notes to familiarize himself with the previous wound care treatments provided to Miss Parr. Manny explains to the client what he will be assessing and how he will be dressing the wound before he sets up his dressing change supplies, including a sterile dressing tray. Manny offers Miss Parr an analgesic for pain before the dressing change, but she refuses same. Manny removes the old dressing from the client's coccyx area and he assesses the old dressing. He sees that there is dried blood, fresher serosanguinous drainage, and no purulent drainage on the old dressing. After cleansing the wound, Manny assesses the wound's location, size, depth, stage, wound bed appearance, peri-wound skin, exudate, odor, pain, and they look for signs of general wound infection. Manny's wound assessment findings are as follows. Miss Parr's wound is located midline over the coccyx. The wound is almost a perfect circle and it measures 1.6 centimeters by 1.3 centimeters. The wound is less than 1 millimeter in depth. The wound is a stage 2 or partial thickness skin loss. The wound bed is made up of red and pink granulation tissue and the wound edges are flush with the base. There is no redness, warmth, induration, or maceration noted in the peri-wound skin. A small amount of serosanguinous exudate was seen on the old dressing, on the gauze used to clean the wound, and in the cleansed wound bed. There is no foul odor present after cleansing the wound. Miss Parr stated that the removal of the old dressing was a 2 out of 10 on the pain scale. The cleansing of the wound stung a bit and was 3 out of 10. And after the new dressing was applied, her pain was down to a 1 out of 10. Miss Parr refused analgesics for pain before and after the dressing change. And there were no signs of infection noted. No redness around the wound, no increased warmth, no swelling, no increased pain, no purulent exudate, no foul odor, no necrotic tissue, no complaints of malaise or fever from the client noted. When Manny completes the sterile dressing change and repositions Miss Parr so that she's comfortable, Manny also assesses for contributing factors and completes a pressure ulcer risk assessment. Manny assesses the client's pressure ulcer risk using a validated tool, example, the Braden scale, and asks Ms. Parr questions involving pressure and shear and repositioning. He also notes if incontinence or excess moisture around the wound location could be contributing to the pressure ulcer risk. The LPN asks the client questions about their nutrition and hydration, medical history and medications, and previous wound history, as they may affect wound healing. Manny clearly documents each component of the coccyx wound assessment, as well as the type of dressing that was newly applied to the wound and when the next dressing change is scheduled. Pause the video to consider this practice scenario. When you restart the video, I will discuss if Manny met his professional standards or not. In this scenario, the LPN, Manny, met his standards of practice and conduct by appropriately assessing Ms. Parr's coccyx pressure ulcer. This scenario demonstrates appropriate nursing practice. The LPN conducted a comprehensive focused wound assessment, considered contributing factors, used clinical judgment to guide care, and documented thoroughly. Assessment was used to inform action, not simply to complete a task. Because the LPN assessed appropriately, the impact to the client was that the infection risk was reduced, wound healing was supported, pain and complications were minimized, and the client received timely, safe care. This scenario highlights how a good assessment prevents harm. This is the type of practice the CLPNM expects and supports. Nova LARP, LPN, works on a surgical postoperative unit in a Winnipeg hospital. When Nova starts their shift, they discover one of their clients, 69-year-old Mr. Walls, is due to be discharged home this evening. Mr. Walls has a past medical history of hypertension and type 2 diabetes and spent the last couple of days recovering from knee replacement surgery on the surgical unit. As Nova completes their first set of client rounds and medication passes in the morning, Mr. Walls states that he was very nauseous overnight and had vomited just before Nova had entered his room. Mr. Walls did not want to bother the night nurse, so he waited for the day nurse. Nova obtains the client's vital signs and sees they are slightly abnormal, as in the client's blood pressure, pulse, and temperature are slightly elevated. Mr. Walls states he is sweating a bit, still feels a little queasy, and has no appetite, but he feels a bit better and is looking forward to going home later today. Nova documents the client's vital signs on the appropriate flow sheet, but does not chart Mr. Walls' complaints, symptoms, or that his vital signs were slightly abnormal in the IPN. In the afternoon, Nova prepares Mr. Walls' discharge documents and educates him on when to seek help if his knee is bothering him. The LPN does not follow up with Mr. Walls regarding his complaints from that morning. They failed to complete a full assessment, including checking the diabetic client's blood sugar, and they did not call the physician to assess the client. Nova leaves at the end of their shift and mentions in passing that Mr. Walls has been feeling ill earlier in the day in their report to the oncoming evening shift nurse, but does not elaborate and states the client seems fine now. That evening, just as the client's wife is packing up the last of his belongings, Mr. Walls collapses onto his hospital bed and a code blue is called. The next day, Nova returns to work the day shift and is surprised to see Mr. Walls is still on the unit. Nova is questioned by their manager about the previous day's events involving Mr. Walls. Nova admits that the client had complained of nausea, vomiting, and no appetite in the morning, and that his vital signs were slightly abnormal when they checked. Nova states that the client seemed fine the rest of the shift, and he was being discharged that day, so they did not feel it was necessary to assess any further than checking his vital signs one time. When questioned as to why they did not check Mr. Walls' blood sugar considering his past medical history, Nova simply states that they did not think to do that, and they had several other clients who needed their attention. NOVA also admits to not documenting the client's complaints and symptoms in a chart note because they did not assess anything beyond obtaining his vital signs. Pause the video to consider this practice scenario. When you restart the video, I will discuss if NOVA met their professional standards or not. In this scenario, the LPN, NOVA, did not meet their standards of practice and conduct when they failed to appropriately assess their client, Mr. Walls. Discharge planning does not override assessment responsibilities. The LPN should have completed a focused assessment in response to reported symptoms, investigated abnormal findings, reassessed and escalated concerns, and documented and communicated. Assuming a client is fine because discharge is planned is unsafe practice. Failure to assess the client led to missed warning signs of deterioration and delayed diagnosis and treatment. In complaints against registrants involving missed or incomplete assessments, the CLPNM considers whether reasonable assessment was completed, whether abnormal findings were acted upon, and whether documentation supports clinical reasoning. The CLPNM may identify unsafe practice, failure to identify risk, and/or failure to follow standards and employer protocols. This may result in remediation, conditions on registration and practice, or discipline. Amrita Singh, LPN, is working an evening shift on a unit in a personal care home with two healthcare aides, Jordan and May. During supper service, two separate urgent concerns occur within minutes of each other. The situation is as follows. In room 12, Mr. Dubé, 79, is found on the floor beside his bed. The fall was unwitnessed. He is awake and calling out. In the dining room, Ms. Klein, 83, suddenly stops eating, looks pale and sweaty, and says, "My chest feels tight, and my arm feels funny." Amrita immediately recognizes that both clients require prompt assessment, but one presentation suggests a time-sensitive, potentially life-threatening condition. She uses her clinical judgment to prioritize based on ABCs, airway, breathing, and circulation, risk of deterioration, and the need for urgent interventions. Amrita determines Ms. Klein's symptoms are consistent with a suspected myocardial infarction, which is time-critical and carries a high risk of sudden deterioration. Mr. Dubé's fall is urgent, but he is awake, speaking, and breathing. He can be kept safe in place with support, while Amrita addresses the higher risk presentation first. Amrita asks healthcare aide Jordan to stay with Mr. Dubé, keep him still and safe, and not move him. Amrita instructs Jordan to ensure the call bell is within reach if possible, maintain the client's privacy and comfort, and observe for level of consciousness, obvious bleeding, and complaints of pain. And to notify Amrita immediately if Mr. Dubé becomes drowsy, more confused, vomits, complains of severe headache and/or neck pain, and has trouble breathing. Amrita asks healthcare aide May to bring the vital signs machine and emergency kit to the dining room and to notify the charge or designated on-call contact per facility process. This delegation ensures both clients are attended to, while the LPN maintains responsibility for clinical assessment, decision-making, and escalation. Amrita immediately assesses Ms. Klein where she sits and notices the client's appearance is pale, diaphoretic, anxious, and she is clutching her chest. The client is mildly short of breath and speaking in short phrases, and Ms. Klein's skin is cool and clammy. The client's vital signs are obtained, and they are abnormal. For example, her pulse is rapid and her blood pressure is high. Ms. Klein's symptoms include tightness and pressure in the chest radiating to her left arm and jaw, nausea, and a sense of doom, and her symptoms began about 10 minutes ago and are worsening. Amrita calls for urgent help and initiates emergency response or EMS, or directs that it be done immediately, per facility protocol. Amrita positions Ms. Klein for comfort, stays with her, and performs ongoing reassessment. Amrita also reviews whether there are applicable orders or protocols for chest pain, example, oxygen parameters and medication directives, and follows them as appropriate within policy. Amrita then provides a concise report to responders or EMS using a structured format, example SBAR, including symptom onset, vital signs, and observed changes. Once emergency supports are in motion and Ms. Klein is being actively managed by EMS, Amrita goes to Mr. Dubé. She finds him still on the floor with Jordan present as instructed. Before moving him, she performs a post-fall assessment. Amrita's post-fall assessment findings include the fall was unwitnessed, the client is unsure how he ended up on the floor, the client is alert, slightly frustrated, and recalls getting up to use the bathroom. Mr. Dubé is unsure if he has hit his head. There is mild scalp tenderness and no obvious deformity. The client reports right hip soreness, about a 4 out of 10 on the pain scale, and he has a right forearm skin tear. Mr. Dubé denies any new numbness or tingling. His grip strength is equal in both hands, and his pupils are equal and reactive. And the client's vital signs show mildly elevated blood pressure and pulse, normal respirations, and oxygen saturation within normal range. Amrita calls the appropriate clinician or the most responsible provider per facility policy to report assessment findings and receive direction. She arranges safe transfer using the appropriate equipment and team, example, mechanical lift if indicated rather than manual lifting. Amrita initiates neurochecks and post-fall monitoring per protocol due to the unwitnessed fall and uncertainty about a head injury. Amrita notifies the client's family and documents per facility policy. Before the shift ends, Amrita ensures thorough charting for both clients, including assessment data, actions taken, response to interventions, and escalation steps. Amrita also ensures completion of an incident report and clear handover to oncoming staff. Pause the video to consider this practice scenario. When you restart the video, I will discuss if Amrita met her professional standards or not. In this scenario, the LPN Amrita met her standards of practice and conduct by using clinical judgment to triage competing priorities, delegating appropriately to healthcare aides, completing focused and timely assessments, escalating care promptly, and documenting accurately. From a regulatory perspective, Amrita's actions align with what the CLPNM would expect of a reasonably competent LPN when faced with two simultaneous changes in client condition. Amrita appropriately recognized that both situations were urgent but not equally time-sensitive, applied clinical judgment to prioritize assessments based on risk of deterioration and potential for immediate harm, delegated appropriately to healthcare aides with clear instructions and escalation parameters and followed up with them, maintained accountability for nursing assessment and decision-making, and documented and handed over care, supporting continuity and safety. From a CLPNM lens, this scenario demonstrates effective triage, safe delegation, and sound clinical reasoning within the LPN role. When multiple clients require care, LPNs are accountable for deciding who needs to be assessed first, who can safely wait, and what supports must be in place in the meantime. This scenario sets a clear benchmark for safe prioritization and delegation, and serves as an important contrast to later scenarios where these skills are not applied effectively. River Kowalski, LPN, works an evening shift on a unit in a personal care home in Manitoba. River is the only nurse on duty and is working with two healthcare aides, Elena and Mark. It is 1700 hours and evening care and medication administration is underway. Within a short period of time, two clients experience a change in condition. In room 5, Mr. Reimer, 88, presses his call bell repeatedly and tells healthcare aide Elena that he has lower back and abdominal pain rated 7 out of 10 on the pain scale. He appears uncomfortable and restless in bed and states this pain is worse than usual. In the common area, Ms. Chen, 82, suddenly drops her teacup, has slurred speech, and appears unable to lift her right arm. Healthcare aide Mark notices that the right side of her face looks droopy. Ms. Chen looks confused and cannot clearly answer questions. Both healthcare aides report these concerns to River within minutes of each other. River decides to see Mr. Reimer first, stating, "Pain of 7 out of 10 needs to be dealt with right away." River does not consider the time-sensitive and potentially life-threatening nature of Ms. Chen's symptoms or risk of deterioration principles when prioritizing care. River tells healthcare aide Mark to keep an eye on Ms. Chen and to let them know if she gets worse, without providing specific instructions or activating any emergency or escalation processes. River remains in Mr. Reimer's room for approximately 25 minutes. During this time, they assess Mr. Reimer's pain verbally, administer PRN analgesia, adjust his positioning, and document the pain intervention. For the remainder of the shift, River does not reassess Mr. Reimer's vital signs, does not explore potential causes of worsening pain, and does not consider whether the pain represents a significant or acute change. During this period, Ms. Chen is not assessed by a nurse. Healthcare aide Mark later reports that Ms. Chen became increasingly confused, was unable to stand, and began leaning to her right side. When River attends to Ms. Chen after they are finished with Mr. Reimer, they note that Ms. Chen is slumped in her chair, speech is difficult to understand, and she cannot follow simple commands. River asks, "Has she eaten today?" and attributes the symptoms to maybe low blood sugar or fatigue. River tells Mark, "Let's get her to bed and give her a snack. That usually perks her up." River does not complete a focused assessment, use a stroke screening tool, example, FAST, obtain immediate vital signs, activate emergency response or call EMS, and they do not notify the physician or on-call provider promptly. Instead, River asks healthcare aide Mark to help transfer Ms. Chen to bed. Approximately 40 minutes after the initial symptoms were first observed, Ms. Chen begins vomiting and then becomes unresponsive in bed. At this point, River calls for help and emergency services are activated. EMS arrives and suspects a cerebrovascular accident, or CVA. Ms. Chen is transferred to hospital, where she later develops complications related to the CVA. She passes away 2 days later. River documents that Ms. Chen appeared confused in the afternoon and that EMS was eventually called. She does not document the initial CVA-like symptoms, the time symptoms were first noticed, and the delay in nursing assessment. River's documentation for Mr. Reimer focuses solely on pain management. Following Ms. Chen's death, the activities that occurred during that particular shift are reviewed. It is identified that CVA symptoms were present and reported to River early by the healthcare aide. There was a significant delay after symptoms were reported to River and before a nursing assessment and emergency activation took place. Pain management was prioritized over a life-threatening emergency. Healthcare aides were relied upon to observe without a nursing assessment and without appropriate direction or escalation. And documentation and handover did not support safe and accountable care for either resident. Pause the video to consider this practice scenario. When you restart the video, I will discuss if River met their professional standards or not.
In this scenario, it is clear that the LPN, River, did not meet their standards of practice and conduct. While River conducted partial assessments, they failed to use critical thinking and clinical judgment to appropriately prioritize their assessments and care when two clients experienced a change in condition. They did not recognize or respond promptly to signs of a CVA. They delayed their assessment and escalation and inappropriately delegated monitoring to healthcare aides. These actions contributed to delayed treatment and may have contributed to the death of Ms. Chen. This scenario would raise significant regulatory concern because it demonstrates failures in prioritization, clinical judgment, delegation, assessment, escalation, and documentation, resulting in preventable client harm. Overall, this scenario demonstrates breaches related to prioritizing assessments based on acuity, inadequate assessment, delayed escalation of care, unsafe delegation practices, poor documentation and communication, and failure to provide safe client care. As we wrap up this learning module, there are a few key points to remember. Assessment is not a discrete skill, but an ongoing professional responsibility. LPNs are expected to have the nursing knowledge, judgment, and skill to conduct comprehensive and focused assessments, to interpret assessment data, to make determinations about a client's health status, and to act on their findings through the application of the nursing process, which is composed of assessment, diagnosis, planning, implementation, and evaluation. LPNs are professionally accountable for their assessments, including their decisions about when to assess, how they interpret assessment findings, and how they act or fail to act on changes in the client's condition. Maybe you have found that this module has reinforced your existing knowledge and assessment practices, or possibly you have identified areas for improvement. Either way, we hope that you are completing this module with a strong understanding of why a comprehensive nursing assessment is an essential component in providing quality, safe nursing care to Manitobans. If you would like to brush up on your physical health assessment knowledge, Assiniboine College offers a physical health assessment course for nurses. Visit the Assiniboine College Continuing Studies website page for more information. MacEwan University also offers a nursing professional development bundle of online courses, including Introduction to Health Assessment, Nursing Process, and Relational Practice and Communication. Visit the CLPNM website Learning Opportunities page to find a link, or visit the MacEwan University website School of Continuing Education page for more information. Now that you have completed this learning module, your next step will be to confirm your understanding of the material by completing a brief quiz. Note that attaining a successful result on the quiz is a requirement for your 2027 registration renewal. In fact, as part of the CLPNM's Continuing Competence Program, an annual professional learning module and quiz is a requirement for registration renewal every year. This means that until you complete the quiz and achieve a successful result, your upcoming application for registration renewal will not move forward to the approval stage. All questions are answered in this module, and you can return to this module as many times as you like. You are also free to consult any resources available on the CLPNM website, such as the Standards of Practice and Conduct and the Code of Ethics. A successful result is 80%, or 12 out of 15 questions. You will have up to 3 attempts. Each time you start the quiz, you will have up to 90 minutes to complete it. We estimate that for most LPNs, 15 to 30 minutes will be plenty. However, we have allotted 90 minutes in case you need to rewatch portions of this module. We recommend that you don't start the quiz unless you know you have enough time to complete it in one sitting. The quiz is a test of your individual knowledge, so be sure not to collaborate with colleagues when completing it. Also note that any attempt to make a record of quiz questions and answers or sharing questions and answers would be unethical and may be deemed professional misconduct. If for some reason you are unable to complete the quiz in 3 attempts, please reach out to us to discuss your next steps. The quiz has been set up in your online registration profile. To access your online registration profile, first visit our website at clpnm.ca, then select I want to log in to my online profile. You will find this option in the top right-hand corner of our homepage. Once you have logged in, you should see that the quiz is available to you under My Exams on your dashboard. Launch the quiz by clicking on the small plus icon to the right. Your result will be automatically recorded in your online registration profile. You are also encouraged to visit the CLPNM website, where you will find many of the resources mentioned throughout this learning module, including those listed on this slide. You will find our website at clpnm.ca, or if you prefer, you can pause this video and use this QR code to access our website. Additional resources and references related to assessment, which were consulted during the creation of this module, are listed here and on the next slide. Thank you for watching the CLPNM's 2026 Annual Professional Learning Module on meeting your professional responsibilities related to the nursing assessment. If you have any questions about this learning module or your assessment standards, please reach out to the CLPNM Practice Department using the contact information shown on your screen.